Hello, this is Robert Whitaker with Epica Animal Health, welcoming you to the fifth video in our 12 case types series of Epica's HDVI technology. Today we are discussing brain scans. When we scan brains with HDVI CT, we can identify anatomy in 3D and 2D at 300 or 600 microns. We're always going to be using IB contrast. And then, of course, there are just certain brain masses in animal imaging that cannot be seen by CT, and MRI must be utilized to see those brain masses. These are brain masses essentially that do not have any kind of blood supply. When we have a blood supply to a mass in the brain, IV contrast will often highlight that tumor or that mass, and HDVI CT will clearly see it. But in about 20% of the situations that are out there in dogs and cats, you're going to need an MRI to see those brain masses. Our first case today is an 11-year-old Labrador. He weighs 101 pounds. His name is Hunter. He's presented with a fever and nosebleed, placed on a 7-day antibiotic therapy, and there was no result from that antibiotic therapy. So they decided to move ahead with a CT scan on their Vimago. And then, of course, they sent that CT scan over to Peregrine Radiology for review of a radiologist. When we look at Hunter's images, the first thing that you're going to see is that right nasal cavity and that aggressive mass lesion that's taking up the entire right nasal cavity. This is absolutely most likely the origin, because we can see where it's penetrated through and into the brain area of the patient. So we have a nasal mass here that's essentially invaded the brain. And when we get into the brain itself and we look further, we can also see the mass is very prominent. The prognosis here is not good. Our next patient is a 10-year-old Frenchie named Jiggy that weighs 22 pounds. She has a long history of chronic rhinitis. And over the years, antibiotic therapy has helped this dog, but seizures have recently began to occur. The veterinarian decided to take chest radiographs, and those were normal. The veterinarian then decides, okay, let's go ahead and scan the brain just in case with their Vimago and see if there's anything to find. They sent the images away to Peregrine Radiology for it. They found in the images evidence of destructive rhinitis. There's definitely some degradation of the bone structures in the nasal cavities. There's also a nodule that's in the right ventral temporal region of the brain that can be seen clearly in the images. But it is very prominent in the coronal and axial views. There's one more condition that was noted in the images, bilateral otitis media, which is essentially, dual ear infections in Jiggy. So the overall prognosis here, when you're looking at ear infections and you're looking at the nodule in the brain, and then you're considering, of course, the destructive rhinitis and the fact that this is, an elderly dog. The prognosis is essentially maintenance. So how does Vimago and Pico pay for itself in brain cases. Well, brain cases are actually fairly rare. We're not seeing those as often as we're seeing many of the other case types that we're discussing in this series. You can count on about 2 cases per full-time DVM each quarter. So less than 1 a month on average. You're going to scan the brain for a $500 scan fee or more, depending on your situation. That would be about $1,000 per full-time DVM in revenue each quarter. Essentially, the greatest benefit here is we're going to get an answer right now, and the client's actually going to save some money versus going down the road. Now, in some cases, like I said earlier, they're going to have to go get an MRI because maybe that the brain mass does not have a blood supply. Don't forget to go to our website, epicaanimalhealth.com, and learn more about Epicare. That's our warranty, service, and maintenance program for our machines. You may also download our CT Buyer's Guide. If you're exploring owning our technology or owning CT, it's highly recommended that you get this Buyer's Guide, and it's also highly recommended that you register for our CT 101 education course. This is an online education course taught from a basic point of view by our chief radiologist, Dr. Bob O'Brien. If you would like to watch real cases, just like the 2 cases you've seen today, we have over 100 of these cases cataloged on my YouTube channel. Scan the QR code and it will take you to the YouTube playlist with over 100 Vimago and Pico HDVI CT cases for dogs and cats. Thank you for your time and have a great day.